All right, let's talk about health quickly in the context of the vaccine. So Europe is way behind in distribution of vaccines, in spite of the fact that you'd think they'd be way ahead. After all, they have centralized healthcare systems. They have central planners ready to go. They have infrastructure for distributing healthcare because everything's centralized. They have so they have an infrastructure you'd expect to work. They bought a lot of vaccines in advance. So you would think Europe would vaccinate quickly. It's vaccinated very, very slowly, and they've got massive problems in terms of the vaccination. But more than that, even in the United States, vaccination is not going great. And one of the things that are problematic in the U.S. that everybody is going to point to and going to make a big deal out of is the fact that in vaccinating in the United States, we're seeing big inequalities. That is, poor people and minorities are having a hard time getting vaccines relative to, let's say, wealthy people. So, there is lots of discrepancies and weird behavior when it comes to the vaccines. And I would argue that's not surprising, given the fact that vaccines are being distributed by the government. Vaccines are free. I think that the poor would actually do much better in a system where vaccines were sold, vaccines were distributed on a for-profit basis, vaccine were distributed by private entities, including nonprofits, by the way, who would be vaccinating poor people, and employers who would be vaccinating the employees, instead of the private sector distributing vaccines based on priorities given who will pay for the vaccine. Instead of that, we're seeing the government do it. And because the government do it, we're seeing massive distortions, massive perversions. And you might say, wait a minute, that doesn't make any sense. The whole point of the government doing it is to achieve this egalitarian outcome, to achieve equality of outcome in some sense. I mean, ultimately, the National Health Service in England, the NHS, the God in the UK, I mean, you can criticize anything in the UK except the NHS. Ultimately, wasn't the NHS founded a single-payer system run by the government, employed by the government, delivered by the government, in order to make healthcare free of charge at point of delivery, to make it equal between all the different classes in England, so that you got a high-quality, uniform healthcare system? That was the idea. That was the point. And isn't it the case, people would say, that the UK has an egalitarian healthcare system, right? Where the rich and the poor are treated exactly alike. And poverty is not a disability, and wealth is not a disadvantage. By the way, comes from an op-ed written by one of the best commentators on healthcare issues in the U.S. today, by a guy by the name of John C. Goodman, who has, I think, his own institute. It's called the Goodman Institute that does healthcare stuff. This is in a Forbes article called Who is Getting the Vaccine, Who Isn't, and Why. And so he makes this point. The NHS was created for equality. And yet, in study after study after study, they find that the creation of the NHS has not equalized healthcare access or healthcare outcomes at all. That even under the NHS, the wealthy get better service, better quality healthcare, and better outcomes. Here's a quote from a report called the Black Report that was done, I think, 20 or 30 years. The NHS was founded in 1948, so this was done in 1980. This was done in 1980. It will come as a disappointment to many that over long periods since the inception of the NHS, there is generally little sign of health inequalities in Britain actually diminishing. And in some cases, they may be increasing. it will be seen that the group has reached the view that the cause of health inequalities are so deep-rooted that only a major and wide-ranging program of public expenditures is capable of altering the pattern. So the only way to solve the deep-rooted inequalities in healthcare delivery, even under an NHS system, is to double down on the NHS. 2 decades later, in 2000s, another report, the Atchison report, found that not only had inequalities not diminished since the publication of the Black Report, the early report in 1980, they appear to actually have gotten worse. In Canada, studies find that the wealthy and powerful have significantly greater access to medical specialists than less well-connected poor people. High-profile patients enjoy more frequent services, shorter waiting times, and greater choices of specialists, in spite of the fact that they have socialized medicine. Moreover, among non-elderly white population, low-income Canadians are 22% more likely to be in poor health than their U.S. counterparts. So poor Canadians are more likely to be in poor health than poor Americans. That's stunning. It's a stunning result. You won't hear that in the media reported, right? Now, why is this? Because it doesn't cost anything. Healthcare in Canada, for the patient, doesn't cost anything. It costs the taxpayer, who is the patient, but they pay that way. But supposedly at the point of service, it doesn't cost them anything. So why is it that the rich are getting better service than the poor? Well, one reason is that the better hospitals in richer neighborhoods, the better equipment is in richer neighborhoods, the best doctors live in the better neighborhoods. Why is that? Well, because who do you think has more political sway? Because decisions on where to build hospitals, where to put the equipment, what to pay doctors who go to particular hospitals, who determines that? Well, politicians do. Who do you think has more political sway? Rich people or poor people? Well, the wealthy do. So they allocate resources to their neighborhood. It's the same reason why public education in wealthy neighborhoods is far better than public education in poor neighborhoods, even when educational funding in the United States is not based on property taxes. The rich are just better at manipulating the political system to allocate more resources to them. Instead of paying more for the service, they devote more time to politics, which they can afford to do. What else? Well, Canadians and Brits have better social relationships with doctors. So they know their doctors. They go to the same country club with their doctors. They associate with their doctors. So they're much more likely to be able to call up a doctor and say, hey, please, I really need to see you. Can you bump me in the line? And most doctors will say, sure, because they're your friends. Much more likely than a carpenter, bricklayer, waitress at a restaurant. Yeah, the article is in Forbes. It's called Who is Getting the Vaccine, Who Isn't, and Why. And generally, I would encourage people to look up John C. Goodman for healthcare stuff. He's mostly very good. Right? So, now, in Britain, Canada, this isn't true. Britain has a private sector which offers some services. So, a lot of wealthy patients have a financial relationship with their doctor. So even if they're in a public hospital, the doctor's getting paid on the side. And then finally, the fact is that higher income, better educated people are just better at navigating bureaucracy than poor people. They have more time, they have more resources, and they're more educated about it. They know how to do it. So what happens in socialized medicine is you ration. Instead of resources being allocated based on price, Resources are allocated based on political incentives. And they're rationed based on political pull. Somebody said here, referring to an Ayn Rand term, the aristocracy of pull. What we get is aristocracy of pull. Instead of market signals, price signals for value, you get political pull. You get connections. In Israel, they call it protektia, which is translated into protection. You get cronyism. Socialized medicine does not improve the health care even of the poor. What it really does is create a pull-peddling society. It moves us, again, more towards tribalism. And of course, the United States system of healthcare is not a good system because, and the vaccines is a good example of that, because the vaccines have used socialism, socialized healthcare principles. And this was, by the way, established by Trump. The Trump administration decided that the government will be the sole distributor of the vaccines. The Trump administration decided that the government would buy all the vaccines and distribute them all, not use the market system. So we have a system in the United States that's a hybrid between the two. A lot of socialization, some private. The private works great. Socialized works terrible. And even the private, because it doesn't have full pricing mechanisms and signals, doesn't work as well as it could work. Again, America moving towards Europe, not the other way around. America become more socialized, not the other way around. But I would rather be in the American health system than any other health system in the world. Europeans could learn a lot from the better parts of the American health system. And America should learn from itself on how to make its health system a lot better. John mentions that John Goodman used to be actually interested in objectivism. I don't know if he was an objectivist ever, but he was in the 60s and early 70s was used to be one of the distributors of NBI tapes in the 60s, and then I guess Second Renaissance. So very interested in objectivism, influenced by Ayn Rand, but turned to religion, and it is far from objectivist today, but mostly very good on healthcare issues. He gets it. And very, very informative articles. So to the extent that you're interested, that's where you should go.
And to begin with, I wonder if I can ask you to capsulize. I know this is difficult. Can I ask you to capsulize your philosophy? What is Randism?
First of all, I do not call it Randism, and I don't like that name. I call it objectivism.
All right.
Meaning a philosophy based on objective reality. Now let me explain it as briefly as I can. First, my philosophy is based on the concept that reality exists as an objective absolute, that man's mind, reason, is his means of perceiving it, and that man needs a rational morality. I am primarily the creator of a new code of morality which has so far been believed impossible, namely a morality not based on faith.
On faith?
Not on faith, not on arbitrary whim, not on emotion, not on arbitrary edict, mystical or social, but on reason, a morality which can be proved by means of logic, which can be demonstrated to be true and necessary.
All right, all right.
Now, may I define what my morality is?
All right.
Because this is merely an introduction. My morality is based on man's life as a standard of value. And since man's mind is his basic means of survival, I hold that if man wants to live on earth and to live as a human being, he has to hold reason as an absolute, by which I mean that he has to hold reason as his only guide to action, and that he must live by the independent judgment of his own mind, that his highest moral purpose is the achievement of his own happiness, and that he must not force other people nor accept their right to force him. that each man must live as an end in himself and follow his own rational self-interest.
May I?
All right, before we go on, reminder, please like the show. We've got 163 live listeners right now, 30 likes. That should be at least 100. I figure at least 100 of you actually like the show. Maybe there are like 60 of the Matthews out there who hate it, but at least the people who are liking it, you know, I want to see a thumbs up. There you go. Start liking it. I want to see that go to 100. All it takes is a click of a thing. Whether you're looking at this, and you know, the likes matter. It's not an issue of my ego. It's an issue of the algorithm. The more you like something, the more the algorithm likes it. So, you know, and if you don't like the show, give it a thumbs down. Let's see your actual views being reflected in the likes. But if you like it, don't just sit there. Help get the show promoted. Of course, you should also share, and you can support the show at JeronBrooksShow.com/support, or on Patreon or Subscribestar or Locals. And show your support for the work, for the value, hopefully, you're receiving from this. And of course, don't forget, if you're not a subscriber, even if you just come here to troll, or even if you're here like Matthew to defend Marx, then you should subscribe, because that way you'll know when to show up. You'll know what shows are on, when they're on. You'll get notified, right? So, yes, like, share, subscribe, support. Like, share, subscribe, support. There you go. Easy. Do one or all of those, please.